Can I kick off by welcoming everybody to the inaugural meeting of the APPG for Muslim women. My first job, and this gets it out of the way very quickly, is to propose Naz Shah to be the official chair for the purposes of the register of APPGs. And I have to ask everyone to vote for that. Now, can I just ask Shyster? Oh, thank you, Jess, very much for seconding that. Can I ask everybody who is a parliamentarian, so that's the MPs and the peers that are on the call, to vote by just showing their hands, which I should be able to see everybody on this screen. So I'll vote as well. I can see it, right, marvellous. So Naz is duly elected. And now I'm going to hand straight over to her.
So thank you very much for that, Caroline. And can I, as my first job is to propose Caroline Nokes as the joint chair. Hands up, hands raising for that.
Second that.
Right, lovely. Thank you very much. I am just opening all of these up. 1 second. Okay, so I think so one of the things that we wanted to, so thank you for that. And do we elect the officers now? Am I right? Just going through the officers of the APPG, the secretary. So the Muslim Women's Network are providing the Secretariat, but are we having a secretary or we're just having officers and members?
Just have officers, don't we?
Yeah, I think we've got nominations to have Jess Phillips and Nuz Ghani as vice chairs, which I'm very happy to propose that.
And I'm happy to second that.
Marvellous. Can we just vote on that? Perfect.
Thank you.
And then we were going to propose Baroness Hussein, Afzana Begum and Afzal Khan as other officers, rather than giving them all official jobs to do. So we're happy to do those three. Thanks, Jess.
Definitely.
Right, can we vote on that?
Yeah.
Marvellous. Sorry, I'll hand back to you now, Naz.
Right, so first of all, thank you very much for the Muslim Women's Network UK for agreeing to be the Secretariat for that. And I think we need to go through a formal process for that. So can I propose that?
Seconded. Agreed.
Agreed.
Agreed. Okay, lovely. So we have a number of speakers, so thank you very much. And now we've got the official business out of the way. But one of the, for myself, certainly, the reason it's so important, I've been part of the British Muslims All-Party Parliamentary Group. I'm visibly a British Muslim woman, and I think it's really, really important. Now, often what happens is Muslim women's voices aren't heard, aren't projected, and really, really need that space within Parliament and within research and within society. So I'm really, really glad to have an organisation such as Muslim Women's Network UK, and in particular, the work that I've done with Shyster and Pfizer in the past, to strengthen that voice here in Parliament and to make sure that it reaches all areas of Parliament and build on the work that they've already been doing. In terms of my history, it's, you know, I'm a female Muslim. I'm one of very few of us in Parliament. I've been here since 2015. And I really, and I have one of the largest Muslim constituencies of Bradford West, and I also happen to be the Shadow Minister for Community Cohesion. It's really, really an honour to be sharing the chairship with Caroline, who is the chair of the Women and Equality Select Committee. So we have between us vast amount of experience. I'm not going to keep it too long, simply because I know we've got some amazing speakers who are going to talk about the report and what's been launched today. So on that note, I'm going to hand over to Caroline. I might need to leave earlier because I'm sat right next to the chamber, and I will be going in because we've got other debates going on today, which really I need to contribute to as well. So on that note, over to you, Caroline.
Thanks, Naz. And I was supposed to say at the beginning that we are recording this. You can all see the little light in the top of your screens. And if anyone has any questions, please can you add them in the chat bar? I think we very efficiently have put everyone on mute so that you can't butt in. But please, if you've got any questions, add them to the chat bar, and Pfizer is going to carefully monitor them and feed them in. Thank you. So I can see that we've got Afzal, Nuz, Jess here. I haven't seen Afzana and Baroness Hussein on the call, and I know that Baroness Udin is joining us at 1:30, so she's not on the call yet. But the names of all those people attending will be recorded in the minutes. We are going to have a public inquiry point, so the contact details for the APPG there's an email address at appg@MWNUK.co.uk. If anyone, it might be helpful if that were put on the chat bar in case I didn't say it particularly clearly. And it would be really helpful if members were prepared to give approval for the Muslim Women's Network UK to include a new page or section on their own website so that they can share details about the APPG, such as the minutes, the agendas of upcoming meetings, future meetings, speakers that are to be invited, etc. Is everybody happy that we should allow the Muslim Women's Network to do that? Going to have some nods or some hands up just to say agreed. Yeah, perfect, thank you. So that's that one done. As an interim measure, we'd quite like the Muslim Women's Network to be able to advertise and publicise the APPG via their own social media, with a view to reviewing that in perhaps 6 months' time to see whether the APPG needs to have its own Facebook page, Twitter handle, etc. But are we content that the network should be able to use their own social media to advertise and publicise what the APPG is doing? Yeah, marvellous. I've got a thumbs up there from Naz. So I've done those 2 bits. The suggestion is that there should be meetings approximately every 4 months. I'm not quite sure when the next meeting is likely to be, but hopefully one before International Women's Day in March next year. It is not the intention to overload with meetings, but hopefully to be able to invite interesting speakers who will be able to add value and interest and make sure that we are sticking to our purposes. And for the record, and indeed for Parliament's official record, the purpose of the APPG is to support social justice and equality for Muslim women and to transform their lives by debating, scrutinising, investigating and raising awareness of issues affecting them to influence practice, policy, legislation. And there is just a bit, so we've heard from Naz as to the importance of the APPG to her. From my perspective, and as Naz said, I'm chair of the Women and Equality Select Committee, and I have to say, only having been in the job for 6 months now, what has really, 8 months now, has struck me is that we still have so much to do with regard to equality for all women, for BAME women in particular. And when I was asked whether I would consider co-chairing with Naz, my first reaction was, why me? This is not an obvious fit. But then I think back to some of the work that we've done on the APPG already, where it has really hit home to me that we are, and I'll always say this, I'll always take this on myself, I am sometimes far too lazy. And when I'm asking the Select Committee to find witnesses and to get evidence and to listen to Muslim voices on whatever the subject, sometimes it strikes me that we're always hearing the same voices. And then it always hits me like a ton of bricks that we're listening to male voices. And when I'm in my constituency and I go to the mosque, I very, very seldom see a woman there. And so I had a conversation with Shasta over email where I was going, you know, actually, I'm really bad at this. And so this is an opportunity for me to look at it and say, well, if I'm not hearing Muslim women's voices, and I'm the chair of the Women and Equality Select Committee, then who is hearing Muslim women's voices? So I think that's a real determination and passion that I have to make sure that in this place, we will make sure that those voices are listened to, are understood and are amplified across a whole range of issues. So we start with maternity care, and I think that's an absolutely brilliant issue to start with. And hopefully over the course of the next year, we will move on to different inquiries, different subjects. And I hope that I will be able to be relied upon to speak up in the chamber and in Westminster Hall whenever it's required. And I always say, as chair of the Women and Equality Select Committee, it's really It's really difficult. You are pulled in every which way, and every time I go into a debate, I will speak on a range of issues and on behalf of people with protected characteristics, and I'll suddenly walk out afterwards and I go, oh my goodness, I ran out of time and I didn't mention, I don't know, people with disabilities, or I didn't mention LGBTQ rights, and so sometimes it's really hard to fit everything in, but I think there has to be a real determination to do so. So that's me and why I'm doing it. And I'm now going to hand over to Nasmin, who's going to talk about the role of the Secretariat and the aims of the APPG.
Thank you for that, Caroline. I would like to begin by saying how excited Muslim Women's Network are to be the Secretariat for this APPG. For over 17 years, we have been fighting for equality and justice for Muslim women, and in that time, we have been very lucky to have had the support of so many forward-thinking funders who have shared our vision and believed in our cause. The Joseph Rowntree Charitable Trust have walked this path with us from day one and continue to stand with us. Our national helpline, which completed its 5-year anniversary this year, would not have existed had it not been for the support of the Henry Smith Charity and the Tudor Trust, who were its first funders and who passed the baton on to other funders, including Comic Relief, National Lottery, and also the government, who kindly provided us with support through the Tampon Tax Fund. Their collective support has resulted in a helpline that isn't just a lifeline for those in need, but it's also a rich source of data for us, raw evidence of the lived realities of Muslim women in the UK, which we will be able to feed into through the work of the APPG. Our work is being taken even further, the launch of a domestic abuse app, which is being funded by Comic Relief. And thanks to other funders, including National Lottery, we've also now launched our online platform, the MWN Hub, which is another means by which we can liaise directly with Muslim women on all issues. As well as connecting voices and reducing the isolation of Muslim women, which is an issue that has really exacerbated during the pandemic, the MWN Hub will also allow us to share with the APPG the very real, unfiltered, unrestricted opinions and experiences of Muslim women on the matters that affect them. So we will be coming to the APPG with these rich sources of information about the lived experiences of Muslim women, and with it, the support of Esmée Fairbairn, who are funding both the Secretariat services that we shall provide and the APPG's first research inquiry. MWNUK is an example of belief, determination, and collaboration, and what the combination of that can achieve. And we strongly feel that this is also going to be the same way that the APPG is going to be viewed in a year's time. We would go as far as to say that today will be a historic moment, because we truly believe this APPG on Muslim women will bring about the systematic changes that we really need. And as its purpose has been shared by Caroline, will truly transform lives of Muslim women through evidence-based policy influencing, and we can't wait to get started. So without further ado, I will hand you over to the co-chair of Muslim Women's Network, Shah, who will inform you more about our first research inquiry.
Hi everybody. So what I'm going to do is talk about why the APPG has selected Muslim women's experiences as its first piece of research, and then what the next several months will look like for us all. So the poorer maternity outcomes for Black, Asian and minority ethnic women have been known actually for a long time, probably 20 years or so easily, but very little has happened. And I think the concern is the statistics have probably gone in the wrong direction right now. And it's a well-repeated statistic, and I'm going to just repeat it again, which is Black women are 4 to 5 times likely to die in childbirth and during the postpartum period compared to white women, and South Asian women are 2 to 3 times more likely to die. Yet little has happened, and I sort of think, why is that? Is it because BAME women are easy to ignore? They're definitely not hard to reach, which is obviously how they are described, because resources needed to try and speak to them, to find out about their experiences, and then try to address these differential outcomes. But there's an opportunity now that's presented itself, and that's probably for a number of reasons. There's been recently, in the last couple of years, more sort of reports highlighting this issue, but then we've had the COVID pandemic, we've had the Black Lives Matter movement, and that's really shone a spotlight on the disparities in health outcomes in BAME communities more generally. And of course, within that, maternity outcomes was highlighted yet again. So there's a real opportunity now to turn the dial. Right now, all the different stakeholders in the healthcare system are listening and willing to take action, whether it's the Department of Health or the clinical commissioning groups, the hospital trusts, and the various professional bodies, for example, the Royal College of Midwives or the Royal College of Obs and Gynae, who are integral to maternity care. And you'll be hearing from Eddie Morris, who's the president of RCAG after me anyway, about what they're going to do. So we want to try and influence all these stakeholders. And I myself have got an honorary advisory part-time role at the RCOG as a Women's Voices lead. And my role there is to ensure that the RCOG consider women's experiences in shaping their work, their thinking, and all that they do. So of course, this presents itself with another opportunity for the APPG to try and sort of influence their thinking. Now, we want to try and take advantage of this opportunity. Now, the APPG is not the only organisation that is going to be looking at BAME maternity experiences. There are others right now starting research as well, for example, academics, hospitals, and also health charities, particularly maternal health charities. So you're probably wondering, well, why does this APPG also need to get involved? And that's because we feel it's really important that BAME women also shape the research, and they're not just spoken about. So it's important that some research is led by them and shaped by them, because at the end of the day, the outcomes and the findings of any piece of research will be very much determined by what's asked in the first place, and what we may ask may be a little bit different. So, for example, for Muslim women, it's not just about race, it's also about their faith. And because of their faith, their appearance, they may be treated differently because of their appearance, for example, if they're wearing a headscarf. So it's really important that these are considered in any research. And faith is also a protected characteristic. And often when I've had conversations with people about this issue, about conscious and unconscious bias, race is always mentioned, faith is rarely mentioned, it's not mentioned at all. So we feel that we can then try and bring that perspective. And at the end of the day, I think it's very difficult for one organization to cover the entire diversity of BAME women. And also, you know, if all of us come up with, the different stakeholders doing research come up with very similar recommendations and findings, actually that's a good thing. Strength in numbers, and we're harder to ignore, we reinforce each other's point. But you know what, if we come up with something very different to each other, that's also a good thing, because between us, we'll cover the bases. In terms of what the next several months will look like, we put out an advert last month, trying to find somebody, an academic, who could do this piece of research for the APPG. And we received more than 20 high-level applications, PhD level. Unfortunately, we could only choose one person. And pleased to announce that we've selected Dr. Surya B, who's on this call today. And she's an academic, and she's a lecturer at SOAS, and she's also the CEO of the Equality Act Review. So she'll be starting immediately, and she'll start off by trying to devise a national online survey that will be pushed out. So if you can help promote that when it does come out, that would be great, let us know. She'll also be doing one-to-one surveys with 30 to 35 Muslim women. So again, if you know anybody that's given birth in the last 5 years or so, because we want to try and keep the experiences recent, again, please let us know. And then the plan will be, in the next sort of several months, before Parliament goes into recess, the plan will be July. Hopefully we've done the research. Then if everything goes according to plan, is to launch that report at an APPG with our findings. And we're looking forward to, in fact, working collaboratively with other organisations, other stakeholders in this space, and sharing what we're doing and working with each other. So I'm going to stop there, but I want to sort of finish with a plea, which is, If you've got anything particular that you think we should be asking in this piece of research or finding out about, please send us an email, but also put it in the chat, because we are going to be collecting your comments from the chat to really inform our thinking, because Sriya is going to start right now, and then we're going to be talking with her over the coming weeks to shape what that looks like. So it'd be good to try and inform her thinking. So thank you.
And does it now fall to me to introduce Edward Morris, who is the president of the Royal College of, I'm going to get this wrong, Obstetrics and Gynaecology, the Royal College of Obstetricians and Gynaecologists. And he's going to speak to us for, I think, let me just check, only about 5 minutes. That's easy. Now, I'm just going to have to give Shyster the heads up that I'm going to have to head over to the chamber, because the debate that I was expecting to start at 2 has already started. But I hope that's all okay with everybody, and Shyster will wrap up the meeting for us all in due course. Thanks.
Thank you very much, Caroline. Thank you for the introduction. So yes, my name is Eddie Morris. I'm president of the Royal College of Obstetricians and Gynaecologists. I've managed to get my tongue around that one now, but I totally accept it's not easy to say. But I'd like to thank the APPG for the invitation to come today, and especially Shyster for giving me the opportunity to speak very briefly. The RCOG and I both feel this is a really important APPG for us to be involved with, and we're delighted to be able to support the work. But I'd also like to take the opportunity to thank Shyster for taking on the role of Women's Voices lead at the RCOG. Now, I was going to share my screen, but I can see that screen sharing is... Oh, can you do that? Yeah, I've just got some brief slides because Shyster asked me to give a little outline of what the RCOG does, and especially in the area of inequalities that she's highlighted. Thank you very much. So I think that should be coming up. So that's on. Can I just have a thumbs up from Shyster? That's sharing, is it? Brilliant. So I put it on slideshow. So there we go. So just a little outline of what the RCOG does. So our main aims are really to set standards to improve women's health in the practice of obs and gynae in the British Isles and around the world. And our charitable objectives are to encourage the study and advance practice of obs and gynae. But fundamentally, we value leadership, innovation, caring, inclusiveness, trust, and integrity. And we're a very transparent organisation, and we always will be. But fundamentally, we're driven by the highest standards in women's health. So we want to train the best people through our various education programs, and we want to promote high quality research. So we've got the right data that underpins the standards and the work that we do. We do a lot of work with governments, both the UK and globally, and we also do advocacy activities. We want the best doctors to come into the specialty to look after the women in this country. And we highlight to people that obs and gynae is one of the best careers, and we design exams and support anyone who's working in the specialty around the country and around the world. But we do fundamentally and unavoidably have women at the centre of everything that we do. So we have the Women's Network, of which Shyster is the chair, and we're grateful to her for taking up the role, because it is a very important role. This is a committee of a number of women who affect and influence the work that the college does. They sit on every committee that we have. But we also have a really interesting group of the Women's Voices panel, which is several hundred women of all ages, of all gender identities, and of all ethnic backgrounds, who help further shape the work that we do. It's like a several hundred women focus group that we have access to. We're very grateful to their work. Our international advocacy, an example of the sort of work we're doing, is a programme tackling unsafe abortion in sub-Saharan Africa, for which we have a large anonymous donor that's supporting that work that we're doing. And we're trying to make abortion around the world a safer thing. But if anyone who knows me knows that I am driven to reduce inequalities in my area of medicine. When I started as president in December of 2019, in my address, I gave a commitment to steer the college to have one of its top priorities to address inequalities. And there's that figure that that Shaista just presented to you, that Black women have a 5 times greater risk of dying in pregnancy than white women, and if you have mixed ethnicity, 3 times, and Asian women have almost twice the risk. But that even goes down into the adverse outcomes amongst babies too. So to show that we're tackling the issue, we published a report at the House of Lords, Better for Women, last year. And myself and the Chief Exec went to number 10 early on to speak to the PM's race advisor to give some background about where we felt the RCOG could really start to tackle these things. So I set up the Race Equality Task Force, which met a couple of weeks ago. This is in the college. It has numerous stakeholders, both from within the central part of the NHS, but also for around the specialty and anyone who is relevant as far as we're concerned. We're looking at changing policies, we're looking at women's health outcomes, but we're also looking at inequalities that trainees experience throughout their career journey to become a qualified consultant or senior doctor, but also those who are senior doctors who still are experiencing inequality. Our first joint campaign for the Race Equality Task Force, 10 days later, was with 5 Times More, who many of you will be aware of. And we have a 5-point campaign to listen to women and understand their problems, to try to remove barriers to communication, to check that clinicians are providing clear information and provide access to detailed documentation. So, because not everything can be digested in one single visit, but fundamentally to be a champion for inequalities wherever you are. So I hope that I've shown that as a college, we have a drive. This is a fresh drive, and Shaista couldn't have joined the Women's Network at a better time, in my view. And so I'm very happy to be here and help the APPG with whatever, in any way that the RCOG can. Thank you.
Thank you, Eddie, and we'll definitely, obviously, once we've got the recommendations and the report, feeding that into the Race Equality Task Force. So now that Caroline and Naz have both gone, I'm going to kind of jump in and try and chair. I don't know if Jacqueline Dunkley-Bent is here yet, because I think she was joining a little bit later. So I'm going to come to you, Faiza, and ask the question if she's online yet. No, not yet. Oh, okay. So in that case, because we're a little bit ahead of time, which is good. I didn't know whether Jess or Nuz, I don't know if Nuz is still online, if you both wanted to, as vice chairs, comment, because I know, Jess, you need to leave early anyway, so I'd rather get you both, in case you have to dash off as well, because I know there's various debates going on in the chambers right now. With regards to anything that you've heard so far.
Yeah, I mean, obviously, I fully support it. And to Soraya, my sister-in-law is a Muslim woman and has had 2 babies in the past 5 years. I shall hook her up with you. Some of the things that I think that we should make sure that we are considering is with regard, and I'm sure that this will be the case, is with regard to, it's everybody's favourite subject at the moment, public health responses, and a changing landscape of public health responses. I mean, I did some equalities work in the Midlands, which obviously has a massive Muslim population, probably now about 10-15 years ago, around infant mortality rates within inner city Birmingham. And the rates being quite high, and there was quite a lot of public health responses to that at the time. And I just think that maybe looking at what has been done well in the past, where that maybe has fallen down, where things have got better, is going to be really, really key, because there are some really specific issues that I see with Muslim women in their child rearing years in my constituency. That I think that, could lead to some recommendations potentially around the need for more public health interventions in places like Birmingham and Bradford and other areas with large Muslim women populations. And one of the things that I see again and again is is some concerns over, for example, consanguinity and advice that is given to people around consanguinity, and other issues that I feel that there is currently a gap in proper programmes where I live around those sorts of issues.
Thank you, Jess. Nuz, would you like to comment? And if is Afzal still online as well, if he wants to comment as well? So go on.
So thank you for the presentation and letting us know what the first inquiry is. I think following on from what Jess has said, there's been a huge anxiety at the moment over the role of Public Health England and its inability to collect data to understand the infection and fatality rates among BAME people within Public Health England, let alone BAME people who are infected with COVID. So I think we need to understand whether there is a Public Health England angle to what is the report that you're going to investigate. And as Jess mentioned as well, if we are saying that BAME women and Muslim women in particular have the same economic background and the same access to services to other women that are equitable to them, thinking about class and economics here, then what is it that sets Muslim women apart? And one of the issues that I think we should discuss is familial relationships and intermarriage, as Jess mentioned, but also potentially the age that they are giving birth. And I would also think it'd be good to see if we can investigate how long they have been in the country, i.e. if they have been recently arrived because of marriage, and there is an issue there to them being able to access services or denied having a voice because assumptions are made around them. I think if we're going to launch any work, and considering we are talking about Muslim women, which people then can consider that we are trying to overtly focus on an issue that doesn't exist. We need to make sure the data is absolutely there, Shaista. We need to make sure we can back up everything we're doing. Can I just say two more things? And I'm sorry, because it doesn't relate to the report that you're about to do. A number of us, and myself included, are doing as much as we can because we're anxious about Public Health England's inability to try and explain fatalities and infection rates amongst BAME people. Is there an opportunity for us to also then pull out some of the data and look at infection and fatality rates amongst Muslim women, whilst this issue is so topical right now? So when we are responding to Public Health England or the government, we've got this data to hand. So I don't want to miss an opportunity and wait several months for this to come forward. And Shasta, if within the network we can get that data sooner rather than later, it will be incredibly important.
Thank you very much, Nuz, for your comments. Afzal?
Oh, thank you very much, Shasta. Can I first to say I'm delighted to be joining this team. I think it's a very important work. We've already seen from this morning the need, and I'm sure there's a lot more actually than what we've already discussed this very briefly. So I'm looking forward to helping and supporting in any way I can. Manchester also has a large number of BME here. Anything I can do to assist at that level, more than happy. And I think you already got a very good academic Saraya with you, who I've worked with in the past. I've seen how dedicated, committed, and able she is. So I think we'll be able to do some excellent work here. So thank you.
Thank you very much. I just want to check in with Faiza in terms of the next speaker before I continue. Shall I carry on?
No, she's not with us yet, so do carry on, and then maybe we can start
well, actually,
questions too.
Because Afzal's mentioned, sorry to throw you in it, Saraya, because he's mentioned you, and obviously you will be doing the research. So I don't know if you wanted to make any comments in terms of, you know, what your plans are for the coming weeks, and you know how you think this will shape up, really.
Yeah, sure. Hi, everyone. Complete and absolute honour to be here today and also be conducting the research on this. I'm really committed and dedicated to Muslim women's life outcomes, social life outcomes, health outcomes. I've done a lot of work in the past, particularly looking at their experience of work and career development, which Afzal and I worked together on earlier this year. In terms of the next couple of weeks, I'm finalising the survey, which we'd love to have input. I know a lot of you have put your contact details in the chat box, which I've just been taking a note of, and I will be in touch just to have, you know, if you have any ideas in terms of how to shape the survey, any questions that you feel that should really be asked, that would be great. But a lot of the comments so far in terms of the age at which they first gave birth, the number of children they have, when they first access services, things like that, we're definitely fleshing those out and splitting the survey up in different sections. So we're hoping to hopefully be live with the survey in the next few weeks, and be running it through the Secretariat and the APPG to make sure that there's clearance before it's put out. But that's the immediate steps, to have the survey out in the next few weeks.
Can I just ask how it's going to be, how are you going to get it out there? Like, you know, I mean, I'll tweet it, but I'm not sure that that's the best network.
Yes, so I think it's amazing. I think MPs are really effective in sending things out, and we've worked that in the past. I think as a Secretariat, MWN has an amazing network. I myself have a wide network through the Equality Act Review, but also my own personal academic networks as well. I've done a number of reports, a number of research projects in the past, which social media has been effective for, but also network groups through kind of at the community level as well. So it's tapping into a wide variety of mechanisms, and we definitely have a lot of plans on that ground too.
Good.
But can I just confirm, we are examining the higher risk of fatalities for women, BAME women, and particularly Muslim women in childbirth? Is that correct? That is what we're looking at, because if that is the case, then every hospital which has had a woman die in childbirth will have had an inquiry. How do we get hold of that information, what those hospitals have found and researched?
Eddie, do you want to comment on that?
Yes, I can comment on that. So at the moment, there's one group that's particularly looking into that data in quite some depth. So some participants may be familiar with the work of the Embrace collaboration run by Professor Marion Knight. And it was her data over the last goodness knows how many years that has shown, and this is what drove me to start looking at this, shown that 5 times more gap for many years in a row. And she particularly highlighted it in this year's report. And so she also runs the policy research unit, and she has been tasked to get richer detail into some of the reasons why there may be an increased risk of deaths in BAME women. The problem, though, is that is still looking at data that comes out of the maternity system. And I think where the APPG adds value here is the listening to the experiences of women, because I think fundamentally it's the experiences that we need to hear more about, because I don't think, if we don't, it's hard to understand whether people get access to healthcare in the same way if they are, for example, as someone was saying earlier about how long they've been in the country, were they afforded the right opportunities of access to healthcare? So there is work being done, but I think listening fundamentally needs to be added to this. And so that's why this APPG is of great value.
Professor, I raised those 2 points, which is great. I think what I would like to see is a list of where all these deaths have taken place and which trust up and down the country. Obviously, the listening exercise is important, but the people that we're trying to represent are no longer here. And there must have been a breakdown in health provision during their time in hospital or prior to hospital before they gave birth and they died. And that information will be held within the hospital. So the point is, Jess and I and other MPs, if that information isn't easily available, we can do FOIs, whatever we need to do, but we need that data. It was the moment they were giving birth when there was obviously a breakdown in care, if we think that is the case.
Thank you. So because Jacqueline hasn't arrived online, and it could be something to do with the internet connection, because I believe that she was going to try and join us via her mobile. She was going to stop and she was en route somewhere. So I think because we've started the Q&A anyway, so we'll carry on. So if you've got any more questions, please do ask them on the chat, and then Faiza or private message or put them on the chat. So I will, I noticed a comment by, I know Baroness Uddin is online, if she can hear me, I think you've mentioned where we could also go and speak to women or find out more information. If you wanted to make a comment, Baroness Uddin, if you're still there.
Yeah, she may have dropped out. I have a question. Okay. Ed, I have a question that has come to me. So you've obviously spoken a lot about tackling inequalities, and your passion is quite clear. how long do you think it will take to shift the needle on this and for us to start seeing the disparities reduced? And will the public be able to see the changes as they happen? So I guess the concern is always that research sometimes, listening exercises and research sometimes takes years and years, and in 5 years we'll only be able to see stuff.
That's a really fair question, Fraser. And the one encouraging thing about this sort of data is it is at the moment collected annually, and so that is possible that when we look, that these are the more severe outcomes. The thing that always worries me when we're looking at mortality and affected babies is actually behind the scenes, as it were. There are dozens of near misses. And those near misses could be just as distressing for the families involved and just as impactful, maybe not just as impactful as death, but still very, very impactful to how their family works. And so I think seeing those endpoints will be harder, but the hard endpoints of maternal mortality, that is published regularly. In terms of the speed of onset, I think it's in the hands of organisations that are here around this virtual table today. It's gathering a speed of momentum to try and effect change. Now, pregnancy has a duration of 9 months. I don't need to tell everybody here. And that's one of the benefits in taking action with maternity, is that generally you do see things change relatively quickly. You're not looking at, like, say, slowing down the onset of a cancer, which could be years in the progress. You're looking at the output of a pregnancy. And so there are sometimes quicker wins than are expected, but still you're looking at maybe several years before you see an effect. We're thinking, we haven't set it yet, of setting an aspirational aim to halve that disparity by 2025.
Thank you. And Shaista, I've got one for you actually. So the APPG on British Muslims already exists. What makes the APPG on Muslim women different?
Okay, so in terms of any research that this APPG does, it could be done by other APPGs, actually not just the APPG on British Muslims. For example, there's various health APPGs as well. The reason why we felt it was important to set this particular one up is because Muslim Women's Network have rich data source. So there's information that we've coming in about lived experiences from the helpline. Then we do research anyway. Then there's a membership. Then now, as Nazmin pointed out earlier, we've got this new portal where women can share their experiences, talk about, particularly those that are isolated, and share their experience on that. So we actually have quite a rich data source. Now, that data is shared anyway. So for example, we set up an online data sharing platform, which was actually funded by the Tudor Trust. And that allows us to share statistics from the helpline with academics and funders and whoever really wants to access that information. But I think the worry is once we send all of our information out there, we can't control whether people even look at it, whether people use our information. So we thought it would be quite an ideal that if the Secretariat, we can channel all the information that's at our fingertips, why not do that as well? And to make sure that we utilize data, because right now, I think evidence-based policy influence is absolute key, and we can do that. However, having said that, I think that this APPG can work in collaboration with other APPGs, regardless of whether it's the British Muslim APPG or the various health ones. For example, we might want to do something on mental health. So I think collaboration is always really, really good. And of course, we have our own networks.
Can I just say, because there's problems that Muslim women face, and that's enough reason, and that they are problems specifically for Muslim women, and that is why we need people to organise to make sure that's okay, and that the more general ones are absolutely certainly ones that we can work for, but there is a problem and we want to solve it. And that's why we should exist.
Thank
Thank you. I think Zaleka had a question. I saw
Yeah,
something.
so there's a couple of people have asked around how we will make this research, I guess, representative across the UK. Someone else mentioned the Northeast in particular. Yeah.
Okay, I mean, maybe Surya can come in on this, but I think, look, I think initially, I think the plan is to maybe focus on England. I think we're quite worried that with 35 women, because healthcare is devolved anyway, and we thought if we start having maybe 1 or 2 in Wales, 2, 3 in Scotland, someone could say, well, that's not enough to try and influence what's going on in Scotland or in Wales. So, and we've got a limited amount of resource. So we thought if we start off by focusing on England, where we've got probably the greatest networks anyway, and then we can influence a bit more. But that research, once it's done, can be used by others as well, and that's probably the first bit of research. Who's to say that we will then not do other areas? In terms of, you've spoken about Northeast, I think when it comes to England, we should be well covered because we've got networks across England, in fact probably across the UK, but that is probably where most of our membership is, and the majority of the Muslim population anyway. So Nazmin is from the Northeast, so we'll be relying on you, Nazmin, to make sure that you cover that. So I think our networks are pretty good, and I think Surya, you also have really good, and you're the key researcher as well.
Yeah, just to add on that, I think it's a really great point to ensure that voices from the Northeast are incorporated. Again, I think it's about pushing it through the networks. I think the MPs, both who are at this meeting and outside of this meeting, who are from the Northeast, Naz particularly, who has one of the largest constituencies that are a Muslim population in the North, would be great to kind of push this survey across. But we also do have personally very strong networks, as I've mentioned in all of my previous research, there has not been an issue with representation from the Northeast. It's actually been by far, either the largest or the second largest group that has been regionally represented in the research that I've done in the past.
And I think it's also, when we're talking about representation, it's not just about location, it also has to be ethnicity. Muslim women, that people forget, are so diverse in terms of ethnicity as well. And I think sometimes there's a tendency lumping, even, for example, South Asian women together, someone who's of a Bangladeshi or Indian or Pakistani background, their experiences may be different. And again, there's a tendency to, for example, lump Black women all into one, whether Afro-Caribbean women maybe have a different experience to women from, for example, from Africa. So Somali women may have a particular experience unique to her compared to, somebody from another country. So I think sometimes those differences are missed. So that is something that obviously we are going to do our best. And we do have a limited resource. We're not going to sort of pretend that the research that we come up with is going to cover everything, is going to be perfect. But I think it should be enough to find out from women's perspective what their experiences are. So if they feel, and there's lots of different contributing factors to why there are poorer outcomes, it's not going to be one factor. So if when the factors are, for example, conscious and unconscious bias, and there will be just one of many factors, we want to know what that looks like for women themselves, and those experiences may vary. For example, for a Muslim woman who wears a hijab, to the woman that doesn't, to a woman that can has, for example, language issues. But then there's also anecdotal evidence suggests that, for example, Muslim women who are educated, British born, who can advocate for themselves, are saying, actually, we feel that we've been treated differently. So we kind of need to find out what that looks like so we can make some recommendations.
So just a couple other points. So there's a request from Nicola not to forget Scotland, also with a sizable Muslim female population, Muslim female population as well. Eddie, there was a question in there around capturing race data, capturing ethnic data as standard in across the board, and how can we better make that happen so that we have the right data available in the first place?
That's a very good point, and that's one of the things that we've noticed, that it's not captured particularly well, and we are pushing for that to be captured better, because a lot of the information we get out of the system comes out of the NHS data stream to try and reduce the workload on clinicians extracting more data. So it's what's automatically there. So we're pushing for richer ethnicity data as part of the work that we do. And I know, Shasta, you're very keen to get that refined, because it's a much wider thing than a lot of the standard questions that exist on the system.
Thank you.
Yes, that's right. And I think in terms of Scotland, just want to quickly make a point that I think I mean, at the moment we're shaping the survey in terms of the questions. So maybe, and this is a question for you, Surya, to think about, does the national survey that we do become a UK-wide survey that then does cover beyond England, Northern Ireland, Scotland, Wales, England, and then when it comes to interviewing the women, because it's such a small number, to maybe focus on Birmingham, or whether we focus on, for example, the Secretariat is based in Birmingham, and as Jess pointed out, there's a large, population, a diverse Muslim population. Could it be that we do focus the research there, and then that's representative of the Muslim population more widely everywhere else? Or do we just focus on the 35 in England, and then we have, so these are all questions now that we've got to really think about and go over, I think, over the next few weeks. So I don't know if you wanted to comment on that, Surya, because I know we've spoken about this briefly.
Yeah, so we have spoken about this briefly, and it's great that these things are also coming up in this meeting. I think there's benefits on either side. It might be that, I mean, and we can have these discussions, it might be that we start off as broad as possible, have a UK-wide survey, and then narrow down the interviews to a certain section of the population, or at least that way we have a broad range and we can have more variety with the findings. Whereas if we do an England only, and actually we get more of a demand to be able to fill in this survey, because at this moment as well, we don't actually want to exclude or make certain women from certain areas feel like they've been excluded. So that's something that I'll definitely be considering. In the past, I have done UK-wide surveys, and that's worked really well, and then done a case study on a certain kind of geographic location or ethnicity. So that's worked well. In terms of ethnicity, I think that's a really good point that people have mentioned and raised. We do now have a very, like a 12+ category of ethnicities that are being used, and that I've used in all of my previous studies. But I recognize that it's not still been translated into institutions such as NHS or even in government departments, but it is happening, and rest assured we will be using as inclusive and as broad possible, as much ethnic categories possible in the drop-down list that people can select.
Okay, now the chat is like livening up, and I'm trying to keep up. So Shaista, I'm going to come to you, and then Eddie, I'm going to also give you one, and then you can respond accordingly. So Shaista, a question for you is, once we've done the research, how will this APPG ensure change actually happens? So practically, how will it be influencing policy? So just hold on 1 second. And then Eddie, I don't know if you caught on the chat Richard's comment, essentially asking how can what is happening be used to galvanize the work of MVPs, and how can the work already kind of happening support the work that we're proposing?
So in terms of how do we shift policy and practice, I mean, that is, I guess, the point of this could have been done outside of the APPG. So I think, first of all, by this research coming through the APPG, and then you've got politicians who will hopefully then be advocating. Already you've heard from all of them that's very passionate about the issue. So I think that makes it a little bit easier. And then with Caroline Nokes being the chair of the Women's Equality Committee. So I think the voice becomes more powerful through the APPG, with more direct inroads right into the Department of Health. And I think also our networks have increased in terms of the NHS. So in fact, during COVID, what we noticed was that we were getting contacted by health stakeholders that have probably not engaged with the Muslim Women's Network before, saying to us that we need to try and reach Muslim women with information, or what are the experiences of Muslim women. So suddenly, actually, we've increased our contacts this year because of the COVID pandemic. So I would say that we're actually in quite a good position, not only with the network of contacts that suddenly increased as well, but what this has shown us that they are ready to listen and take action. The opportunity is there now to shift the dial, which wasn't there before, because sometimes you can really shout and there could be 100 organizations shouting about the same thing. But if people who have the power to make things happen are not listening to you, you can't do it. But the fact that we've got Eddie here, and RCOG is integral to maternity care, and they want to make a difference. They've set up the Race Equality Task Force, so we can feed our research into that task force. I mean, Jackie unfortunately couldn't make it. She is the chief midwife in the NHS. So therefore, she's been or had already reached out to us as well. So I think there's a massive opportunity now for all of the organisations, not just the APPG, to really shift the needle. If we don't do it now, we never will, basically.
Thank you. I mean, I was typing and trying to respond. I think we've also had some questions around from Salma and Huda around postnatal depression and domestic abuse and how that will factor into the research. And I think I'll just kind of use my liberty to say that, as the Muslim Women's Network UK and from our data on the MWN helpline, it's always at the forefront of our minds and will definitely be considered in this research. So we're 2 minutes away. I'm not sure what's happened to Jacqueline, but no doubt she's been held up somewhere. Shaista, I think we can say thank you to everyone, and thank you to everyone who's contributed on the chat.
Yeah, so thank you everybody for attending today. And I just want to finish off by one thing, thanking you, but also keep the suggestions coming in terms of, I know we've talked about maternity care. What should the APPG be looking at in the other pieces of research? This is just the first one. What should the next one be? And someone's already mentioned mental health, and mental health is our second biggest call on the helpline. Should that be the next research that we do in terms of Muslim women's mental health experiences? Are the services meeting their needs? Could that be the next piece of research? So keep those suggestions coming in the chat, but also email us as well. So I will, and thank you very much, Eddie, because I know you're super busy. An hour is a long time, because I was really worried that you would not be able to fit us in. I'm glad that you came. So thank you very much, and thank you very much, and thank you to I know the politicians have gone. They've gone to the chambers right now. So I don't know if you wanted to say anything, Nazmin, add to what I've just said, and then we can wrap up and close the meeting, really. Yes, no, would you like to say anything as my co-chair?
I just want to add to what Shaista said. Thank you everybody for being involved, and we really hope that you will continue to stay involved with us. As I said before, this is a collaborative effort, and we need everybody to support us in this if we're really going to make changes. Thank you.
Thank you, and I will close the meeting. Thank you very much.
Thanks, everyone.
Thank you. Bye-bye.
Bye-bye.